Hello, I'm Dr. Rizwan. I'll be attending the patients. What happened to your dad?
Well, he had abdominal pain, difficulty in breathing, and had nausea and vomiting 2 times a day.
What his name?
James,
James. How old is he?
68 years old.
68. Does he work or do any kind of job?
No, he's a pensioner.
Pensioner. What is his nationality?
Russian.
Uh, where he live?
Karla
Kardamaksa. Okay. What are his main complaint?
He has pain in abdomen everywhere.
Are there any other complaints such as difficulty breathing?
Yes, he has.
Does he have vomiting?
Yes, he has vomiting also.
Does he feel any weakness or fatigue?
Yes, he did.
Yeah. Does he have fever?
No.
Does his appetite normal?
No, not.
Not
His
normal.
appetite is not normal.
He use bathroom normally?
No, he didn't use bathroom for like 2 days.
When did this pain start?
3 days ago, this pain started, but we didn't came to hospital.
Does he take any medications?
Yes, he takes anti-inflammatory,
Anti-inflammatory. Which medicine?
diclofenac for like
Diclofenac.
3 days.
3 days.
Mm.
Did he ever have trauma?
No,
Did he have normal urinations?
no, not for 1 day.
Any allergies?
Yes, he has to the Novocaine injection.
Does he ever had gastric ulcer?
No,
No. Has he had drug transfusions?
no, he didn't.
Does he smoke?
No, yeah, yes, he smokes like 1 pack a day since 40 years.
Does he ever consume alcohol or drug abuse?
No, he doesn't consume alcohol.
Okay. Does he have any family history of any disease?
No, we don't know.
Does he suffer from diabetes mellitus?
Yes, so 4 years, since 4 years.
Has he had any operation in the past?
No,
Does he have TB?
no, he did.
Okay. Does he suffer from stroke?
Yes, he did.
Does he have myocardial infarctions?
Yes, like 4 years ago.
4 years ago. And does he have any childhood diseases?
No, he don't.
No. From here, we can conclude that the patient is suffering from respiratory dysfunctions, hepatic dysfunction, and gastric dysfunction. Now I want to see his conditions.
Okay.
Can you please open the eye? Can you flex the arm? Do you know where are you now? Please open your mouth. Can you please pull out your tongue? Okay. Okay. The patient is severe. He look older. The skin is greenish yellowish, and the disease scale is 13, and the mucous membrane is dry and low turgidity. Here we can conclude that the patient has hepatic dysfunction and hypovolemia. We did inspections. We will do the palpations. Say 33.
3
Do you feel pain? Say 33.
3
Say 33.
3
Okay. He has no pain. Now we'll do the percussions. Now we will do the auscultation. By auscultation, we find the wheezing sound and crackle in lower part, and from here we can conclude that the patient is suffering from the respiratory dysfunctions. Objective for cardiovascular: first we will do the inspections. Okay.
Proper order. Okay. Stupid razor.
Correct.
Auscultation, we find the back sound, and from here we can conclude that the patient is suffering from cardiovascular dysfunctions. We'll do the auscultations of the GIT. We will do the palpations. Do you feel pain?
Yes.
Do you feel pain? 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 We'll do the percussions for GIT. Okay. So the patient is suffering from MODS non-infections, from hypovolemia and some respiratory problems, cardiovascular problems, CNS problem, dysfunctions of liver and renal dysfunctions. Hypovolemia resulted from the hemorrhagic from the vomiting and respiratory losses, inflammation as a result of presence of non-infections, respiratory dysfunction as a result of secondary systemic inflammatory response syndrome, cardiovascular from the tachycardia, hypotension, effect of hypovolemia, CNS dysfunction result from fluid loss and systemic inflammatory response syndromes, liver also same, and conclusion of respiratory dysfunction resulted from the shock and systemic inflammatory response syndromes and low pulmonary pressures and edema. Cardiac dysfunction resulted from hypovolemia, and hepatic dysfunction resulted from ischemia. GID dysfunction from the ischemic changes in tissue. Renal dysfunction resulted of hypotension. CNS dysfunctions resulted from the decrease in blood and perfusion to brain and systemic toxin. Conclusion that the patient has MODS, including the 8 organ dysfunction, resulted from the abdominal aortic aneurysms rupture, hypovolemic shock untreated, resulted systemic inflammations, result in MODS. Goal of treatment: intensive care, urinary catheter, partial pressure of carbon dioxide and oxygen support, IV access needed, infusion therapy, 5% dextrose in water and half normal saline, oxygen therapy, corrections of anemia by blood transfusions, support liver, and corrections of hemostasis.